If I can turn to another issue, and it's an aspect that I'm surprised is not included in the bill. As you know, the government has taken the decision to provide for medical indemnity for the 6 COVID-19 vaccines that they have signed up to and pre-purchased. I think the government has pre-purchased 8.5 million doses of vaccine, and there's more to come in terms of vaccine doses, and we'll probably have 4 or 5 more vaccines. Now, as part of the vaccination programme that you discussed at Cabinet on Tuesday, recipients will have to receive 2 vaccine doses, and they will have to be 2 weeks apart. Now, Minister, we're talking about 2 vaccine doses, 2 weeks apart. We're talking about 6 different vaccines floating around there. Minister, that's a recipe for absolute and utter chaos. And we're asking the Health Service Executive to manage it. This is the same organisation that lost 600,000 flu vaccines a few weeks ago and didn't know where they were because they haven't got the data systems to manage a handful of flu vaccines. How in God's name are they going to manage 8.5 million vaccine doses and more? We don't have a unique health identifier, which we legislated for back here probably about 6 years ago at this stage. And I think, Minister, in the short term, while it's not an ideal solution, I think the only solution is to use the PPS number. And it's the best short-term option to be able to monitor and manage the vaccination programme across this country. But to do that, Minister, we need an amendment to the existing legislation covering the operation of the PPS number, and it's not in this legislation. And Minister, without having some type of a tracking mechanism, which I think, as I say, in the short term is only the PPS number, then managing indemnity by the State Claims Agency in terms of these vaccines will be next nigh to impossible. We need detailed and accurate records, and they're vital to flag up adverse reactions to specific vaccines. And I think it is imperative, Minister, that we have, as a matter of urgency, a full debate in this House on all of those related issues.